Hello and welcome. We're going to talk about infertility today, which I know can be a really personal and sometimes difficult journey. So this explainer is designed to give you a clear, straightforward overview to help you understand what the path forward might look like. Let's get right into it.
We've broken this down into 5 main parts. First, we'll get a handle on what infertility actually is. Then, we'll walk through what to expect at your first doctor's visit. After that, we'll dive into the key factors that affect fertility, explore the different treatment options out there, and finally, we'll touch on how to navigate the emotional side of all this. Okay, so let's start with what is probably the most important message of all. If you've been finding this whole process frustrating and maybe a little isolating, please know that you are so far from alone. In fact, about 1 in every 7 couples has trouble conceiving. And what that number really tells us is that this is a common medical issue. It is absolutely not some kind of personal failing. It's an experience that so many people share. So what's the actual clinical definition we're working with here? Well, infertility is defined as not being able to get pregnant after 1 full year of trying. Now, that timeline does shorten to 6 months for women who are 35 or older, and that's a really key distinction because it encourages getting an evaluation sooner so no time is unnecessarily lost. So maybe you've passed that 1 year or 6-month mark. What's next? Your first doctor's visit. And I know this can feel like a huge, maybe even intimidating step, but it is also the most proactive and empowering thing you can do to start getting some real answers. During that initial visit, your doctor is going to want to talk with both of you. You'll go over your medical histories, you'll discuss your journey so far, how long you've been trying, all of that. And look, this is your time to ask absolutely everything you can think of. The whole point is to walk out of there with a clear plan for what comes next. Honest, open communication is it's everything. Now we get into the real detective work, investigating the potential causes. And it's so important to remember that for more than a quarter of couples, there's actually more than one thing going on. That's exactly why a really thorough investigation is so important. And when you look at this breakdown of the primary causes, it's pretty revealing. You can see the factors are spread out pretty evenly. About 25% of the time, it's related to ovulation. Around 35% of cases are due to issues with the fallopian tubes. And then, in about 40% of cases, there's a male factor involved. This really just drives home why both partners need to be part of the evaluation right from the very beginning. So to really understand the tests that are coming up, let's do a super quick biology review. For pregnancy to happen, 3 really critical things have to go right. First, an ovary has to release an egg. Second, sperm has to get to that egg and fertilize it inside the fallopian tube. And third, that new little embryo has to travel to the uterus and implant. A problem at any one of those stages can cause an issue. Let's zero in on that first critical step, ovulation. Not releasing an egg regularly accounts for about a quarter of all infertility cases. A really simple but powerful clue here is your menstrual cycle. If it's regular, and by that we mean somewhere between 24 and 34 days, that's a very strong sign that you are probably ovulating. And doctors have a few different ways to check on this. Beyond just tracking your cycles, a simple blood test can measure a hormone called progesterone, which confirms that, yep, ovulation did happen. And you can even use those at-home ovulation predictor kits to detect the hormone surge that happens right before an egg is released. Okay, we also have to talk about age. This is a really crucial factor because a woman's fertility does naturally start to decline in her mid-30s. And this is driven by a decrease in both the number of eggs she has left and, just as importantly, the quality of those eggs. So to get an idea of this age-related fertility potential, doctors measure something called ovarian reserve. This usually involves blood tests to check key hormones, like FSH and AMH. And it's often paired with a transvaginal ultrasound, which lets them actually count the number of little resting egg follicles, giving a much more complete picture. All right, next up is the tubal factor. Think of the fallopian tubes as the pathway where the egg and sperm are supposed to meet, so they absolutely have to be open and working correctly. Any kind of blockage or damage there is a big deal, accounting for about 35% of infertility cases. The main test to check if that pathway is clear is called a hysterosalpingogram, or an HSG for short. Basically, it's a special kind of X-ray where a doctor uses a dye to see if it can flow freely through the uterus and all the way out the ends of the fallopian tubes. And the results are pretty easy to see. If a tube is open, you literally see the dye spill out the end, showing that the path is clear. If it's blocked, well, the dye just stops, which tells you there's no way for the egg and sperm to meet in there. Now, let's switch gears and talk about the male factor, which is every bit as significant. In about 40% of couples, male factor issues are either the only reason or at least part of the reason for the infertility. That's why a semen analysis is one of the very first and most important tests that gets done. A semen analysis really looks at three key things. First is the count, which is just the total number of sperm. Second is motility, which is how well they're moving and swimming. And third is morphology, which is all about their shape. You need all three to be in good shape for the sperm to be able to do its job. Now, beyond those three main areas, other things can also play a role. You could have issues inside the uterus, like fibroids or conditions like endometriosis. And for about 10% of couples, believe it or not, all of these tests come back totally normal. That leads to a diagnosis of unexplained infertility, which I know sounds frustrating, but it does still have its own treatment paths. So after all the tests comes the conversation about what to do next. And the great news here is that modern fertility treatments offer more hope for successful pregnancy than at any other time in history. Treatment options are always tailored to the diagnosis. It might start with medications to help with ovulation. The next step could be something called intrauterine insemination, or IUI, which basically gives the sperm a head start. For more complex problems, there's in vitro fertilization, or IVF, where the egg and sperm are combined in a lab. And in some cases, the journey might involve using donated eggs or sperm. Each of these is a big conversation to have with your specialist. And finally, it is so important to acknowledge the journey itself. Yes, this is a medical condition, but it's one that can carry a really heavy emotional weight. It is completely 100% normal to feel angry, sad, guilty, stressed out. So many couples feel isolated because it can be so hard to talk about this with friends or family. The most important thing to remember is that these feelings are a valid response to a medical situation, and you are not alone in feeling them. And we'll end on this really powerful quote from the source material. The sooner you meet with the specialist, the sooner you will find answers and be able to realize your dream of having a child. You know, at the end of the day, taking that first step to get help isn't just about tests. It's about taking action, it's about finding answers, and it's about reclaiming a sense of hope on your path forward.